Hi, I'm Nancy. Welcome to Mindful Yoga. Today we're doing the second in a series on pelvic health. Have a block with you if you have a block or a pillow, something that you can hold in between your knees. If you don't have anything, you can still do the practice. Take a seat now so that we can breathe a little bit, coming into some calm as we come towards this yoga time on the mat. Invitation to come into the body. Let the breath bring you there. Just noticing the inhale and the exhale. Eyes soft, a little long in the neck, a little tuck in the chin, a little rise from the bottom of the spine up to the top of the spine. Relaxation down through the shoulders, down through the lower ribs, into the pelvic floor. Face relaxed. Lower ribs expanding as the breath comes in to the sides of the body, the back of the body, and then at the top of the breath, the front. Enter the space inside you. See it as already infinite, extending forever in all directions. This spaciousness that you are is permeated by luminosity. Know this radiance as the soul of the world. A few more full, round breaths here, increasing the space within you, the spaciousness in your heart and mind. Then opening your eyes, bringing one hand down, one arm up, opening out on the lateral side, relaxing down through pelvic floor. You'll remember in the first session of this pelvic health yoga, we brought out the idea that the pelvic floor should not be so tight, nor should it be loose. It should have the suppleness to be able to contract and expand. Be like a trampoline with bounce and recoil. Coming back through center, one hand comes over to the opposite thigh, other hand back behind. And just for a moment, coming forward on the sits bones, long through the spine, feeling that spiraling of the spine, just warming the spine up for the rest of our practice. Long, back and forth, one more time. Then coming back through center, bring the arms together and open. Elbows are low here. It's not such a broad cactus at first. Just beginning to open through the collarbone area. Now come a little wider into cactus arms, elbows coming out from the shoulders. A little more opening between the shoulder blades and also the shoulder blades coming together as the cactus arms and fingers reach up. And now relaxing more through the arms, soft through wrists and elbows and shoulders, becoming almost like a bird's wings reaching out and the openness reaches up and down the spine. And you feel the front of the spine opening, and then the back of the spine opening. Making space, physically and mentally. Then bringing the hands down to the thighs. Let's run our hands forward on the ground. So just feeling the carpet or floor in front of you as you slide your hands out. Feel the stretch through the hips and the back. Then giving some support underneath the shoulders so your hands aren't too far out now. Bring some arch to your spine so that you are stretching all those little muscles, the multifidus muscles between the vertebrae. And then flattening out a little bit and doing that once again. Recall that the pelvic bowl is supported by 4 sets of muscles. One is the muscles in the pelvic floor. On the top, the diaphragm. In the front lower abdomen, the transversus abdominis. And in the back, the multifidus that we're stretching right now, all the little muscles that go between the vertebrae. Now we're going to come into a lying position. And if you have a block or a pillow, have that near you now. We're thinking about doing some gentle core exercises that can strengthen the abdomen with less pressure inside the abdomen. But still, if you are injured or have some weakness in the abdomen, it's a good way to start getting more strength in the abdomen to support the whole pelvic bowl and particularly the pelvic floor, and allowing it to be more supple. One heel slides down from bent legs, the toes are up, other one slides down and back. Let it be slow. Notice what engagement of the abdominal muscles and the pelvic floor happen here. One last time on each side. And another gentle core exercise that you can do. Arms can come out from the shoulders horizontally. One leg is bent, so let the left leg stay bent. Pretend that there is a glass sitting on the top of the knee. And the right leg, knee, comes out to the side and lifts slowly back up. 2 more times. Left knee staying still. Again, a subtle movement, but then one that requires some gentle opening and engagement through the abdominal and pelvic muscles. I'm doing the other side now. So the right knee is bent and holding the glass, and the left knee is slowly opening out to the side and returning up. Then if we get a little bit stronger, we can do toe taps. So my knees are slightly bent, toes are lifting and coming down. Knees really aren't moving, they're staying in the same position, and the toes are coming up and down, tapping. This is a Pilates exercise. Feel there's a little bit more required of the abdominal muscles and a little bit more of the pelvic floor muscles. And then bringing the feet down. If you want just a little bit more exercise for the transversus abdominis, this lower muscle that wraps around from the spine and comes together in the middle of the lower abdomen. Arms are along the side, palms down, head and shoulders rise, and one hand comes down beside the foot on that side, and then the other hand beside the foot on the other side. And you'll notice it requires a little bit more engagement of the pelvic floor and the transversus abdominis. 4, 3, 2, and 1. And come back down. So if you are doing some exercises after injury, or if you're building your strength, the transverse abdominis is very important, and also the oblique muscles that are along the side of the waist and up along the side of the ribs. Bring your knees bent over your hips. This is called the dead bug. Fingers are up towards the ceiling. We're going to bring right arm and left leg, extending right arm overhead and extending left leg down towards the bottom of the mat. And then opposite left arm and right leg. Back and forth. This kind of movement in the opposite sides of the body is also a good brain exercise. Gentle but effective way to build up the strength. And this is good for both obliques and transverse abdominis. One more time on each side. And leaving the knees bent above the hips, raise the head. Fingers are behind the skull on each side and elbows are wide. Bringing elbow to opposite knee, a little more strenuous, extremely good for the oblique muscles on the sides of the body. And again, not rushing through it. The slowness requires a little bit more endurance of the muscles, builds them slowly and steadily. 3, 2, and 1. And bring it down. Let's take a long stretch. One arm reaching up and the leg reaching down on that side. Maybe the wrist pulled by the hand up above. It's a nice long stretch. You remember last time in the first pelvic health yoga, we talked about the synergy of breathing with the pelvic floor and the diaphragm moving together. This happens naturally, but we're just exaggerating it a little bit. Bring your fingers to the transverse abdominis and lower abdomen. Inhale, both the diaphragm and the pelvic floor dip down. And then as you exhale with a hissing, and continue dipping down. Inhale, exhale, engaging pelvic floor, diaphragm, and transverse abdominis. 2 more times. Now extend the right leg out. Left leg stays bent. The arms are out to the side. Lift the hips slightly so that you're rolling them over towards the right, towards the side of the extended leg. The knee stays right above the hip on the left side. Then lift hips slightly and bring them down. Lift hips slightly and bring them down. One more time. And notice the suppleness here of the pelvic floor. Once again, so the same thing on the other side. The left leg is extended, the right leg is bent. Lift the hips slightly and roll over just a bit over towards the left side. The right knee is right above that hip. And lift up as you push into the foot, the right foot, lifting the hips slightly. As you come down, inhaling, exhale as you rise up slightly, just an inch or two. One more time. And bring it down. Now bring the soles of your feet together. Soles of feet together. Fingers to the transverse abdominis. Inhale as pelvic floor and diaphragm relax down. Exhale, lift hips, pressing the feet together. Soles of the feet pressing down, the sides, the edges of the soles of the feet pressing down. Inhale, hips are down. Exhale, you might hiss as the hips lift up. When you're down, inhale. Press feet down, lift hips. Two more times. And come back. All of this is good for incontinence, which is something that sometimes people experience as they age. We're going to come into a squat now. And this is an imaginary squat. It's not feet on the floor, it's feet on the ceiling. So knees are wide, elbows are between the knees. Inhale, relax. As you exhale, perhaps with a hissing sound, push knees together and elbows out. Inhale. Inhale, press knees together. Two more times. Now taking that block or pillow, whatever you might have, or perhaps having nothing, and that's okay too. But if you have a block or pillow, put it in between your knees now. We're going to do a bridge pose, which we often do, but we'll be pushing together our knees in towards that block, making sure knees are parallel, but also that push with the knees brings some engagement to the pelvic floor and strengthens there. Inhale, exhale as hips rise. Bring it down. Inhale. Exhale. You might blow through pursed lips or just breathe naturally. Now this time we're going to inhale down, exhale as you rise up, suspend the breath as your hips come down, and then inhale once they're down. Exhale with a hissing sound as the hips rise. Suspend the breath without breathing, hips come down. Inhale. Exhale as hips rise. Suspend the breath. Hips come down. So you're creating somewhat of a vacuum there. Inhale, your hips are down. Exhale, hips rise. Suspend the breath. As the breath is suspended, bring the hips down. We'll do it one more time. Inhale with hips down. Exhale, hips up. Suspend the breath, hold it. Hips come down. And breathe naturally. Now we're going to come up into bridge one more time. Take the block from out from between your knees if you have it there. Press into your feet, raise your hips. You might want to tuck your shoulder blades in and interlace your fingers for a little more support through shoulders and arms. Bring your weight into your left foot. Extend the right foot out and bring it back. Weight into the right foot. Extend left foot out and bring it back. Weight in left foot, right foot extends out. Weight in right foot, left foot extends out. One more time on each side. And bring it down. Now we're going to roll over and come on to tabletop position. Hands are under shoulders and knees under hips. Just take a moment to open up the front of the spine here. And open up the back of the spine. One more time each direction. Then we're going to tuck our toes and slide back and slide forward. Exhale back, engaging pelvic floor, and slide forward, inhaling. Slide back, exhale, slide forward, inhale. Then we're coming down into locust, a little bit of exercise for the multifidus muscles, those little muscles between the vertebrae. Arms are along the side. Stretch the legs down and the crown forward. Inhale with everything down. And then exhale as arms, legs, head, and shoulders rise. When you're done with a long exhale, come down. Inhale. Exhale, rise and hold. Inhale, down. Exhale, rise and hold. And bring it down. Now we're going to do a Superman. So we're going to lift arms and chest and legs off the ground with arms out to the side as if we were flying like Superman. For 3, 2, and 1. Hands come under shoulders, tuck toes. Hips rise up into downward dog. And let's pump the heels, bringing some circulation into the calves and thighs, some springiness into the feet. Let's be long back through the arms, through the sides of the body. Then we're coming forward into plank. Hug in around the navel, the muscles around the navel, hug them in. So you're cinching in around the waist and scooping the belly. Cinching in around the waist and scooping the belly for 3, 2, and 1. Then bring the knees down. Turn the right foot out to the side as you come up over. So we're coming up into a side plank, and there's this option for having the knee in the center here, or bringing it out. So either way is fine. And whichever way you do it, we're just going to hold here for a moment. And if you are able to, bring hips down a little bit for 3, 2, and 1. And coming back through plank and over to the other side. Just allowing yourself that little support in the middle if you'd like, from the under leg. Perhaps coming out into a longer side plank, and hips might go up and down a bit. 3, 2, and 1. And then we'll bring hands back and come into a forward fold. Hands to the shins, long through the spine. Forward fold once again. Drape down over the thighs. Arms come wide and hands out. Heart forward and eyes forward as you come up. And then coming up into mountain. A very simple thing to do to help any kind of incontinence is to simply sway back and forth from heel to ball of foot, swaying back and forth. This simple movement just brings a gentle tension to the pelvic floor. And as I said the last time, we don't want to have a tense pelvic floor, and yet we want to encourage gentle strength, of course, in the pelvic floor as well. So then stopping for a moment and relaxing the pelvic floor. So practicing relaxing the pelvic floor as well as engaging it. And then you could sway from side to side, coming over on the sides of the bottom of the feet. And this is also something that brings some gentle engagement to the pelvic floor. And back through center, relax down through pelvic floor. Asking a little bit more of the pelvic floor, let's bring our hands up overhead and raise up on tiptoes. So heels come up and down. So a heel pump up and down. As you come down, inhale. As you come up, exhale. As you come up, down, inhale. As you come up, exhale. You don't have to make a noise, because as you come up on your toes, your body really requires your pelvic floor to engage, as well as the transversus abdominis, the multifidus, the diaphragm. It's all getting stronger there. Pelvic girdle strength. Now we're going to come down into a squat. Get any prop that you might like. You might want to have a blanket for your heels. You might want to have block to bring your buttocks down on. That would be fine. So finding your way to come down into a squat. If you have a blanket, you might want your heels up on the blanket. That sometimes helps. Or you might just be in a little bit of a squat standing. If you can have your elbows in between your knees, that doesn't mean your knees need to be really far apart, because remember, you've got hip joints there that have a certain range of motion, so keeping that in mind. Inhaling, and then squeezing the knees in and the elbows out slightly so that they're resisting each other as you exhale. Inhale. Exhale. Inhale. Exhale. 2 more times. And just a note, if squats are difficult for you, you can do it against a wall. I don't have a wall I can really use here, but you can put your back up against a wall and it becomes more easier. Constipation is also something that can give problems to pelvic floors. So one thing to do to help constipation, bring your hands down in front and just let your body, your spine curve slightly in the back so that you can feel that pressure of the thighs against the abdomen. So the squat can also be good for constipation, just by coming forward a little bit. Bring your weight forward and then weight into the hands and come up, slowly rising up with a Then we're going to come into a chair pose, another strategy for strengthening the suppleness of the pelvic floor. Again, option to have a block in between the knees. We do chair lots of times, so you know what to do. Hips come out and back, arms come out in front with palms facing each other. And we're going to exhale. Then inhale up. Your arms can be by your side or up overhead. Then inhale. Exhale. Inhale up. Exhale. Inhale up. One last time. And rise up. Now we're going to do an eagle balance. So if you have a block or something, a book or something that you could put beside one foot, it's a good place to bring your foot around to, the toe around. It can also be on the earth. So if you don't have a block or a pillow handy, just use the earth, the floor. Bring your weight into your left leg. I'm not mirroring you. Right thigh over left leg, left knee bends slightly, and the right toe goes onto the block or the floor. Arms come wide. Left hand crosses under right. Left arm under right. Entwine the arms as you can. Feeling the shoulder blades coming apart in the back. And that toe might lift up or it might not. As an option. Find your version of the eagle balance. And note that there is some strength here in the abdomen, in the multifidus, in the pelvic floor. And then unwinding the arms and bringing both feet down. Relax down through abdomen, pelvic floor, down through the legs, down through the softness of the feet. Just allowing there to be a little more space in all the muscles and blood vessels as you relax a moment. Practicing that suppleness of the pelvic floor. Now bring, if you have a block, bring it over beside the right foot. The right leg becomes your foundation leg. That right knee bends a bit and left leg comes over the right and toe goes onto that block or the floor, or it's hanging in the air. Arms come wide, right arm comes under left arm and intertwines. Having a little dialogue with the floor, between the floor and your foot. Always balance a wobble. That's all right. That's how our body is accommodating the balance. And then unwinding the arms, unwinding the legs. And once again, with an inhale, relaxing the pelvic floor. And even relaxing now as you exhale. So sometimes the exhale gives us a nice engagement in pelvic floor and diaphragm. And sometimes we can let go on the exhale, softening down through cheeks and neck, through the back of the neck, down through the spine, through the sacrum, down the backs of the legs to the feet. Then we're going to come into a high lunge. So let's bring the left foot forward first. All toes are forward, front knee is bent. Find a comfortable place. You might be tucking your toe in the back, or you might be keeping that foot all down on the mat. We're going to bring the arms wide. So I have my arms wide out to each side. Then we're going to twist toward the front leg. The arm of the back leg is going to come up. So that's our right arm. And the left arm will come back behind the waist with the palm outwards. Then feel again that cinching in through the waist, the hugging in of the muscles around the navel, and lengthen up through the sides. Strong. Good support from the legs, good support from the core, and just enough support from the pelvic floor and the diaphragm. And then bringing hands down, feet together. The right foot is forward now in a high lunge. Bring the arms out to the sides once again. Then we're going to do a twist so that the arm, in this case, the left arm's coming around towards the front. So we're twisting towards the right. The left arm reaches up, the right arm comes back behind the waist. Cinching in through the waist, scooping in through the belly, and lengthening up through the sides. Just holding that for a moment. Engagement, strengthening, and then bring it down. And the last thing we'll do for incontinence today is triangle. So triangle also is a good help in warding off incontinence and bringing some strength to the whole pelvic girdle and the pelvic floor in particular. So both legs are straight here, knees are firm but not locked, feeling both feet, the back one at about 30 degrees. It can be a little bit forward if it needs to be for the hip. Bring your hands to hip creases and let the hips go back and forth. Leave the hips towards the back of the pose. Hands come to the chest. Reach out. Eyes go towards the horizon, reaching with the fingers towards the horizon. Then windmilling the hands, one down towards the earth, one up towards the sky. And just notice what the abdominal muscles are doing. The multifidus muscles between the vertebrae, can't necessarily feel those, but they're all working here. The diaphragm, the pelvic floor. Just take a hissing exhale. A little inhale, then another hissing exhale. And you'll notice just good support here. Pretend there's a rope up above, and that upper hand takes hold of it, and up we come. And we'll do triangle on the other side. So finding your triangle legs here, hands to hip creases, hips going back and forth. Ending up in the back, opening through the chest, eyes and fingers reaching towards the horizon, and windmilling. Opening up through the chest, and then bringing the mind's eye to the pelvic girdle, the abdomen, the spine, the pelvic floor, and a few breaths with a short inhale and a long hissing exhale. And taking that rope with the top hand and pulling yourself up. And coming back up. Let's come to a lying position as we end our time together here. When you come down, bend the knees with the soles of the feet on the earth. Bring the left ankle up on the right thigh. And now we're going to really profoundly relax through the inner abdominal muscles, the pelvic floor, the lower back. Bring the left palm against the left inner thigh, press gently. Release down from knee through hips. Release through pelvic floor. The hip and sacrum and lumbar spine. Up behind the waist. Behind the heart. The chin. The back of the neck. Relaxing all the little muscles around the eyes, the lips, and the tongue. One more breath here. Unwind that and bring the right ankle up on the left thigh. Slowly bringing that right palm against the right inner thigh. Just a gentle pressure. Releasing from knee, through the calf, down through ankle. Releasing through the softness of the bottom of the foot. Then feeling a letting go from the knee down through the hip. Profound relaxation of the inner abdominal muscles and the pelvic floor, the diaphragm, the rib basket, supple, just like the pelvic floor. Heart beating, lungs breathing, just enough. Soft up through neck and cheeks, the temples, and the skin all around the skull. Letting thinking go. Letting the mind sift down into the pelvic bowl. The brain of the gut. And then unwinding. Option to come up into happy baby for just a moment and just roll back and forth as we come to the end of our time together. Soothing the pelvic bowl, taking care of this luminous part of our body that supports the bottom and the top. Takes the great weight of the head and the upper body, and then rests that weight down, connecting through the legs down into the earth. Feel free to stay here and relax if you're coming back into your day. Coming into that space which is infinite within you, the spaciousness that you are. Namaste. Thanks for practicing. I'll see you the next time.